Good afternoon, all. Dr. Jared here. Very excited today to share with you a great resource here in the greater Oxford community. Traci Earhart, with owner of Back to You Prenatal Care, which covers pregnant women while they're pregnant, as well as during the birthing process, and even for a short while after. I've gotten to know Traci and her family quite a bit over the years. She's good friends with my wife. And she's really got a great view on helping people prevent versus being so reactive. So maybe we should just turn it over to you, Traci. Tell us a little bit more about your organization.
Yeah. Hi. Thank you. First of all, thanks so much for having me. It's so nice to be here. And I think it was probably about 6 years to the day when I first met your wife. I was pushing a stroller with a newborn and she was 8 months pregnant. So we've come full circle here now. Tell you a little bit about what we do. So the mission of Back to You Perinatal Support is really to provide informed and compassionate support throughout pregnancy, birth, and the postpartum period, like you said, to all mothers who want it. So this means different things for different families and different things for different settings. So during COVID, for example, there's a lot more uncertainty and anxiety around the birth experience, especially for moms giving birth in hospitals. So we're addressing that quite a bit in childbirth classes and one-on-one sessions. But regardless of the external circumstances that we find ourselves in, every woman comes to her birth with unique past experiences and unique fears and concerns and her own values about childbirth and about raising children. So studies have actually shown that mothers feel best about their births when they report feeling in control of that experience. That is regardless of the details of the actual process. So what we try to do is help moms and their partners define their vision for the ideal birth and their postpartum period. And then we give them physical and emotional support and also the education and the tools to go after that vision while still recognizing that birth is inherently unpredictable. But there are things that we can control. So why not feel empowered to control those things? I hope that my clients look back on this whole period, whether it's childbirth or postpartum, and feel that while their strength was really tested, they learned how strong they really were mentally, emotionally, and physically.
Right. That's awesome. You were just talking about how you can make a plan, and I know that we used a doula all through the first birth of our child, and most of my friends did as well. And just really what it brought is that level of experience to something that we were clearly inexperienced in. But maybe you would talk about when I went through one of the classes, they talked about having the birth plan, but also having someone outside of the husband and wife or the partner to help execute it so that they could really stay in the moment, enjoy it, but make sure it was as much controlled as possible. So could you maybe talk about how you help with that or your experience with that?
Yeah, absolutely. There tends to be a little bit of reservations on the part of the birth partner or the father when it comes time to make a decision as to whether to hire a doula or not. And I think the misconception is that it's one or the other. And the ideal situation is that the doula and the dad are working together to support the mom, because the father brings a deep knowledge and love for his wife, and the doula brings skills and expertise around childbirth. And doulas are really filling a gap in the system, not a gap in the relationship. We are providing continuous care that medical staff are just not set up to provide. And that's not a condemnation of them or the medical system. It's just not designed for continuous labor support. There have been tons of studies done on what continuous labor support does for women. And people often think it's this like woo-woo kind of a thing, but there are real numbers showing that women who use professional doulas at their births have a 50% reduction in C-section rate, which is wild and something we certainly want to avoid if we can, though we're grateful there are C-sections when they are needed. But a 50% reduction in C-section rate, 25% shorter labors, 60% reduction in epidural usage, which has pros and cons, certainly. 40% reduction in Pitocin usage, which is what they use to create an induction or to stimulate your own body's oxytocin. And 40% reduction in forceps deliveries. And also, one thing that I think is amazing is that women who use doulas are less likely to have complications that require a baby being admitted to the NICU.
Right. Yeah, and of course, statistics speak for themselves. But what I kept thinking as you just went through that list is like, what does everybody want? They want a healthy mom and a healthy baby. And ultimately, what do you want? A healthy mom and a healthy baby. Okay, so are you going to leave it to chance? And there's nothing wrong. Plenty of people have, but if you could increase your odds, and you're able to increase your odds through wherewithal or knowledge or even knowing that this exists, I'm a big odds guy, and that's kind of sounds like what you're talking about. Healthy mom, healthy baby, more often, faster, less complications. Is that fair to say?
Yeah, absolutely. There's a big piece of education that happens on the front end of working with a client, where we do a lot of prenatal sessions to inform mom about what are all the medical interventions that can happen and what are the pros and cons, so that when they arise or when a care provider suggests something, the mom is already thinking 3 steps ahead. Well, if I do that, I'm more likely to experience this or that, or have this presented to me next. So when the mom is giving consent to those medical interventions, she's giving true informed consent rather than blind consent of, well, here I am, you know best, do what you need to do. A doula helps a mom keep it as her own birth and assigning, her own values to that birth and getting, hopefully, the vision that she has in mind. And, your birth, while it's also, it's an enormous memory and it's a milestone that women don't forget, they pretty much hold that closer to their heart than any other milestone people can remember. You can talk to grandmothers and they'll remember their childbirth experience. It's also one that impacts your future childbirth experience. So to leave that up to chance, you might end up having an impact on your next round, or your family planning, your fertility. All of those things can be impacted by labor.
So you mentioned when we were preparing that your 2 most common clients are first-time moms and then also women trying to VBAC. So can you tell her, why is VBACing such a good thing, or why would that be something that maybe people would want help with if the first one did end up in a C-section, whether it was induction or complication or whatever?
Yeah, so a VBAC stands for vaginal birth after cesarean, and that means that a woman has had a previous birth through cesarean section, which is an invasive abdominal surgical procedure. C-sections carry a lot of risks to mom and baby. Really, any invasive surgery, if you talk to anyone who does surgery, they'll tell you surgery is risky. You have a risk of infection, you have a risk of body complications afterwards. And when we're talking about a newborn, there's also risks to that baby. So a C-section is something that even the gynecological boards are trying to reduce numbers. Everybody agrees that a C-section should only be used in the case of emergency. So when a mom has a C-section birth and then gets pregnant again, she often considers, can she avoid the C-section this time around? You'll find OBs with varying perspectives on that. Some OBs are very comfortable with that, some are not. So it's about finding the right fit. But a woman would want to have a VBAC so that she avoids all of those complications and risks. And also, there's an emotional perspective. I mean, women grow up, most of us, imagining having babies and imagine having babies in the traditional way. And when a mother feels when a mother has a C-section, she often feels kind of robbed of that experience. Oftentimes mothers don't really remember their C-section very well because of the medication required to numb the area. So the whole experience can kind of leave a sad taste in a mom's mouth, and that's more of an emotional reason for choosing a VBAC.
Sure. No, I know, as you know, I mean, my wife, my son was 16 days overdue, induction, C-section, VBAC on number 2 and number 3. And it's not saying there's right or wrong for any of them, of course, but that was something that we strove and worked very hard for, and especially my wife worked very hard for. But you know, you're talking about the one other thing, or one of the last two things I want to make sure we touch on here. You mentioned when we were prepping about, like, you know, if you go to the hospital with a broken leg and you go to the hospital and you're pregnant, some of the protocols are somewhat similar, and like that's not the same experience. One is planned, one is unplanned. So like what experience would be desired, you know, or what increased experience do you want to try and help someone have?
Yeah, so long ago, you know, a few generations ago, medical care kind of took over childbirth. You know, there was a time way longer ago when there were no physicians, and there were, you know, community midwives that would come, and people had babies with their moms and their aunts and all the females in their family and community helping them. But over time, it became a medical event. And so kind of the current majority of thinking is still to treat it that way. So we show up in labor acting like something's wrong with us and like we need somebody to fix it. It's just so not the case. I mean, being in labor is not a woman being broken or needing fixing at all. In fact, it's the opposite. It's a woman's own experience that her body was designed specifically for. So because she's experiencing a physiological phenomenon and not having some sort of medical problem, she really doesn't need any medical attention unless something goes wrong, which rarely happens, but let's be grateful that we have medical attention when we need it, of course. But the mentality of giving birth as if it's something that needs to be managed by a hospital team is actually pretty misguided and can lead people down a path of interventions that they don't necessarily want. And if they knew more about the pros and cons, they might have a stronger opinion. And so, yeah, so, you know, we've even seen home births having a resurgence lately, and that's partly like been true for, you know, the last decade or two, but also since COVID, it's really ramped up. I mean, the midwives that I know, they have only 1 or 2 slots left for the whole year. But there are fewer negative outcomes with home births than hospital births, which often blows people's minds because they think, how could that be? You're having this huge medical event and you're at home. Well, you're not having a medical event unless you need it to be. So my point is not to advocate one path or another or to paint a picture of what birth ought to be. My purpose is to make sure that mothers are really informed so that they're making choices that are aligned with their own values and that they feel comfortable with, rather than relying on blind faith to have some out-of-the-box cookie-cutter experience that's given to you and the woman in the room next to you and the one that's coming tomorrow and so on.
Sure. It's fantastic. So last question, and of course, you know, we feel very aligned in that, in my mind, this is a more holistic, preventative way to do something that the majority of women are going to go through in their lifetime. So why do you find that so many of your clients do utilize chiropractic treatment either for themselves in pregnancy or for their babies, either wellness or, you know, let's say there is something like, why do they do that? Because I know you've seen that plenty.
Yeah, absolutely. The partnership between doulas and chiropractors is one that pregnant and postpartum women are searching for in our community very much. And there are definitely reasons for that. First, from like a collaborative care model, women who are pregnant are experiencing anatomical changes to accommodate their growing baby. And these changes are often associated with all sorts of discomforts. Chiropractic care is a proven remedy for many of those. Oftentimes, OBs don't have the solutions for women with low back pain. And again, it's not a knock on them, it's just not what they do. But women with low back pain or pubic pain or sciatic nerve pain feel that it's an unavoidable consequence of pregnancy and they're just stuck being in pain. But I see and hear about chiropractors giving pregnant women relief in those areas and lasting results all the time. So every pregnant woman I have had as a client who sees a chiropractor swears by their chiropractor and that relationship, just like they swear by their doulas. So I think we are providing collaborative care. And then the second reason I think it makes a lot of sense is more of a philosophical perspective, going back to the holistic element that we were talking about before. It's just that chiropractors and doulas are totally aligned on our mission to help people feel empowered about their health, that they can drive their own health forward without needing a whole lot of intervention, and also providing them the support that they need to make it a preventative measure rather than treating a grab bag full of symptoms that develop over time, when really there's something overarching that we need to address that can help a woman or any patient of yours feel better about their health and wellness.
That's fantastic. Yes. And for those of you that have never seen chiropractic on a baby and things, it's so good for ear infections and well checks and all sorts of cool stuff. So thanks so much, Traci. You have an awesome service and one that's very, very needed in the Rockford community. And have a great day, everybody.
Thank you so much for having me. This is a lot of fun, and I hope everybody feels like they can reach out to me if they have questions or want to chat further.
Certainly. It's right. Her company is right in the link. You can reach out on